Once upon a time, there was a woman named Sarah. Sarah was a 43-year-old marathon runner. One day, while she was on a long run, she tripped over a rock and decided that running was not the best idea. She decided that she should probably take up a new hobby. While she was on her way back home, she stumbled upon her friends playing tennis. Sarah had never played tennis before, but had grown up watching the US Open with her older sister. As she limped past her friends, she stopped to say hello. As she watched them play, Sarah thought that maybe this could be something that she could do instead of running in the future. A few days later, Sarah's friends invited her to play tennis with them. After Sarah's first day of tennis, she loved it, and her friends could not believe that she had never played before. She was a natural. Sarah began playing more and more, and she was getting really good. She even joined a local tennis club so that she could play more rigorously to develop her skills. Sarah was now playing tennis several days each week. She has a natural strong overhead serve, but Sarah wanted to improve her serving for upcoming matches, so she has been practicing extensively over the last few weeks. As she was practicing her serve and competing in matches, she started to notice a pain in her right shoulder. She mostly experiences this pain when she plays tennis and when she is blow drying her hair in the morning. She even experiences some pain and weakness in her shoulder when she is lifting her groceries out of her car after spending way too much money at Target. In addition, she also has trouble sleeping at night, which when she is on her right side. Besides these activities, her shoulder pain doesn't bother her too much. She is able to go about her normal work days as an accountant and able to watch the nightly news pain-free.
We as Sarah's doctors agreed on the diagnosis of a SLAP lesion. A SLAP tear is an injury to the shoulder in the ring of cartilage that surrounds the socket of the shoulder joint. The symptoms of a SLAP lesion tear seem to match up almost exactly as the symptoms that Sarah explained she was experiencing. These symptoms include popping, clicking, or catching in the shoulder, pain when you move your arm overhead or throw a ball, a feeling of weakness, instability, and aching pain. The main concerns that Sarah came to us with is that she's experiencing pain when she plays tennis, blow dries her hair, sleeps on her right side, and tries to lift groceries out of her car. Before we came to the diagnosis of SLAP, we thought it could possibly be a subacromial bursitis. Subacromial bursitis is a condition caused by inflammation of the bursa that separates the superior surface of the supraspinatus tendon, one of the four tendons of the rotator cuff, from the overlying coracoacromial ligament, acromion coracoid, and from the deep surface of the deltoid muscle. Most importantly, subacromial bursitis is tenderness at the outer shoulder, especially when raising the arm above the head. This description of subacromial bursitis is the pain Sarah feels when she is serving a tennis ball, blow drying her hair, and lifting groceries. The reason we ruled out subacromial bursitis is because we believe that the diagnosis of a SLAP lesion related more to the overall symptoms that Sarah was experiencing with her shoulder. Sarah's injury could be helpful. Being 43 years old, she is not in her prime of her life, but easy to get over. In patients over superior age, caring or praying with a superior labor can be seen as a normal process of aging. But in Sarah's case, her chair mildly labeled by jumping in tennis. Sarah's when it comes to health and not not no matter what bicep deltoid muscle.
Since Sarah has just begun really getting into playing tennis, we can imagine how devastated she is with the news of her injury.
Although one day Sarah may be able to play tennis again, for now it will probably be best for her to take a break and rest her shoulder. In addition to taking time off from tennis, she should be doing some extensive physical therapy and rehabilitation exercises to help heal and strengthen her shoulder. Whether she chooses to get surgery or not, these exercises will be very important throughout her recovery, especially if she wants to play tennis again. In the meantime, Sarah can do less intensive activities that do not involve her shoulder to help it heal faster and better. These activities she chooses to do, which can include going back to running and biking, will be helpful. Many activities would be sufficient as long as they stay away from moving her shoulder. The SLAP lesion, just like many other injuries, can be prevented in athletes or non-athletes if they listen to their bodies and do not overdo it. To make sure that they relax. An effective way to do this is by working in different prevention techniques to help strengthen muscles so that when they are used a lot, they will not get injured. According to an article by Dr. E.W. Edmonds, the best treatment for SLAP tear or lesion is prevention. As an overhead athlete, many people like Sarah injure their SLAP lesion very easily. But in order to prevent this injury from occurring in the first place or ever again, it is extremely important to incorporate stretching into one's daily exercise. The stretching will help to maintain overall internal rotation of the shoulder to prevent any other injuries. Lastly, athletes should perform a rotator cuff and shoulder blade stabilization muscle strengthening exercises in order to continue their activities without any